Most new parents are probably wondering, what is it like on the baby's first day of life? What should we expect? Will the baby cry a lot? A lot of questions and anxiety of what's to come. Well, let me address the unknowns and guide you through the baby's first 24 hours. In this video, I am going to tell you what the newborn's typical behavior is, how parents should adapt, and some helpful tips to survive the first 24 hours with your little one. If you stay until the end of this video, I will give you a bonus pro tip on how to survive your second night with your newborn. Hello parents, welcome to Mother Baby Central, your resource for great information regarding pregnancy, postpartum, birth, newborn care, and baby's first year of life. Finally, your little bun in the oven has finally arrived. The much-awaited event is here, and you now have one, or two if you have twins, additional member of the brood. Moms and dads, still with the adrenaline sailing high, at this point, you will most likely be relieved, exhausted, most likely hungry, but nonetheless ready to take on the new role of parenthood. Within a minute after birth, the first sound you hope to hear is a lusty cry. The nurse assigns an Apgar score for 1 and 5 minutes, and this will continue to be done as needed, depending on the status of the baby. The newborns are evaluated and given scores regarding A, appearance. Typically, they are assessed for their color. Is the baby blue? Is the baby pink? P is for pulse rate. A quick way to determine if the pulse rate is good is the baby crying loudly? Pretty much. That pulse or heart rate is normal. Or the nurse will feel the pulsations in the umbilical cord and count the pulse rate by doing so. G is for grimace. When the newborn is stimulated, will the baby cry loudly or just make a whimpering sound? A stands for activity. The newborn is assessed for the tone. When you hold the baby, is the baby limp or are the legs and the arms flexed? And R is for respiration. Is the baby's breathing absent or irregular? Or is the baby crying? 10 is the highest score, and anything above 7 is normal. The opposite of that, less than 7, it means the baby needs additional help. In the first 1 and 5 minutes, a quick assessment using the Apgar score decides whether the newborn can go directly skin to skin with mom or hand it to the baby nurse for further evaluation and assistance. Assuming everything looks great, the Apgar score assigned is 8 and 9. Moms will be able to hold their babies immediately and stay skin to skin with her. For the first couple of hours after birth, this is the time that the newborn is typically most active. Eyes will be wide open, not all of them though. Some babies do not open their eyes immediately, which is fine. Some are already rooting, turning their head side to side, looking for food. Some babies start eating their hands, sucking reflexes present, and all of that good stuff. As long as there are no issues with the newborn's breathing and mom is stable without any complications during delivery, then the baby will most likely stay skin to skin with mom. This is the best time to initiate breastfeeding, or if bottle feeding, the best time to bond and cuddle with the baby and introduce some formula within the first hour. The newborn at this active phase usually are very cooperative. For the first-time moms, if the baby does not latch immediately, don't worry. Breastfeeding is a learning curve. Sometimes it takes a while for the mom and the baby to get the hang of it. The best thing to do is let the baby stay skin to skin with you. After the first couple of hours, the newborn will transition to the sleepy phase. and will actually be very sleepy for the next 24 hours. Moms and dads, this is a very normal behavior, okay? Don't worry too much. The challenging part is waking the baby up for feeding. You will be asked to feed your little one every 2 to 3 hours or by demand when breastfeeding. And you will hear this a lot from nurses. Moms, do not let 4 hours pass without offering your breast, okay? For bottle-fed babies, it will be to feed the baby every 3 to 4 hours with no more than 30 mLs or an ounce of formula for the first 24 hours. Now, breastfed babies in some cases are more difficult to stay on the schedule. With formula-fed babies, sometimes even though they are sleeping, take them out from the crib, hold them, and if you put the nipple of that bottle in their mouth, it gives them enough stimulation to start sucking and swallowing the formula. Alright folks, if you find value in what you just learned, please click on that subscribe button to help out the channel, and I will be able to create more videos and provide everyone helpful insights into these kinds of topics. Here are some pro tips for breastfeeding moms. While your baby is sleeping, please try to sleep as well. Set your alarm in 3 hours. Once the alarm goes off, dads, take the swaddle off your baby and check the diaper. Check if there is urine or bowel movement, and change the diaper as needed. Take note if the baby has a wet or poopy diaper. This is one of the most vital pieces of information you want to know, especially on day 1. If the diaper is clean and the baby is still sleeping, take some wet wipes and wipe the butt area. Not because it is dirty, but it will help wake the baby up. So now moms, as dad is doing this process, try to get up out of the bed, use the restroom and pee as well. And while you're at it, go ahead, change your pads and freshen up a little bit. Refill your water container if it's empty and start drinking. Then, after that, find a comfortable position for breastfeeding. It can be on the bed or on the chair, whichever you prefer. If the baby keeps on sleeping on the breast, dads, here's a trick. Wash your hands with cold water, take the baby's shirt off and rub the baby's back. Tickle on the little feet, gently rub on the ears, or try tricks to annoy the baby. Sometimes these tricks work. If not, take the baby from mom and continue stimulating the baby doing all this stuff I just mentioned. This will take some work, but be patient. Once the baby is more awake and starts rooting, like looking for food, take him back to mama so she can start breastfeeding the baby. Now, write down on the paper how long the baby eats so you know when the next feeding will start again. Take note of the time, like when mom starts breastfeeding. Now, if the feeding is not successful, let the baby sleep in the crib or stay skin to skin with mama and try again in the next hour. If the baby is still not interested in eating, I think it's time to call help and call your nurse for help. For our bottle-fed babies, moms and dads, reminder, please do not overfeed your baby. Just give what the medical staff recommends. There is a good reason why you should only give a certain amount on day 1. Like, it makes them avoid excessive spitting and so much fussiness. The baby's stomach is tiny, like the size of a marble, like this, or like the size of a cherry. So there's no reason to give a lot. As I mentioned earlier, offer less than an ounce or 30 ml of formula. And after 24 hours, you can actually gradually increase the amount you're giving. And you're going to be advised by the nurse practitioners at that point. One last note, most newborns do not cry or fuss as much for the first 24 hours. So enjoy the peaceful moment while you can. The babies are mostly sleeping and have to be woken up to feed. Now, for the bonus, the second night with your baby is one of the worst nights you will ever have while in the hospital. So be prepared for this event. Try to take as many cat naps as you can during the day. As much as you love having your family around to celebrate your baby's birth, this is not a good time to entertain, as you are headed towards the dreaded second night. Day 2 is the perfect time for mom, dad, and baby to bond all together. Just the 3 of you. It is a time to recuperate from the delivery and get as much rest as you can. Hydrate, eat, sleep, feed your baby, and repeat. After watching this video, do you think you'll feel more ready to tackle day 1 with the baby? You've got this, moms and dads. I'm rooting for you. Nothing is easy, but with some preparation and good information, this day will be a breeze. I hope you find value in our content for today. Please share this video to someone who is looking for this kind of information. If you are still in the mood for another great video, check out the link in the description below where I talk about the top 5 essentials you need to bring for baby's hospital birth. Happy watching!